Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Red yeast rice has been used in China and other parts of Asia for centuries, literally for centuries. It's used for medicine to help with circulation, but it's also used for food. It's a staple over there. They make rice wine out of it, and it also preserves flavor and color in fish and meats. For instance, it's the coloring on Peking duck. Now, they make red yeast rice by fermenting a type of yeast called Monascus purpureus over red rice. And what they do, they create something that was the original statin. It's a natural product. It's the original statin. Statins work by inhibiting the formation of cholesterol in your liver. The original statin was called lovastatin, and they got that from looking at red yeast rice. So red yeast rice has ingredients in it, a whole bunch of them, called monocolins, and these in general lower cholesterol, but there's one that's significantly stronger, and that's what they usually make sure that you have plenty of in red yeast rice supplements that are sold in stores. Now, it's a good product for people who can't tolerate statin drugs. It may be an alternative. Stony Brook University out in Long Island did research on that, but this is a study from the University of Kansas and Oregon Health Science University down in Portland, Oregon. It's in the American Journal of Medicine. And they're saying that red yeast rice, which is available in stores, is known to reduce your cholesterol. And it's an alternative for people who cannot tolerate statins. Statins cause myalgia. Pain in the muscles, inflammation in the muscles. It's actually a very common reaction to statins if they're used at a higher dosage. So here's the issue. Doctors put their patients on statins, like atorvastatin, simvastatin, rosuvastatin, and they want to push the cholesterol down to a certain level. And the patients are generally doing fine on that initial dosage of the statin. But quite frequently, it's not a favorable outcome. The doctor wants to push the cholesterol even further down, especially in people with diabetes or who've suffered a heart attack or who have other cardiovascular issues. The doctor wants to further lower the cholesterol, so they increase the dosage, and that's when you really start to run into problems. When the statin drug companies study statins, only 1% of the patients have side effects. But when statin drugs are researched, they're studied by independent universities, etc., and medical centers, the incidence of side effects is much, much higher, well above 10%, sometimes in the 20 to 30% zone, which means 20 to 30% of the patients experience side effects from the statin drug at higher doses. May not happen at a lower dose. And it's an issue because statins inhibit the formation of energy in your cells, and when that happens, that is causing inflammation and muscle pain. And a totally different reaction to statins is if you push cholesterol too low, there's not enough cholesterol left over for the health of your nerves and your muscles, and that's another way that statins cause muscle and nerve pain and nerve damage. But statins can commonly lead to a drop in energy, a drop in strength, a drop in endurance, stamina goes down, and there are some supplements that help offset that. By the way, if you're on statins, we've actually done a couple of episodes on this. Creatine monohydrate, you can use that if your kidney's in good functioning order because it's excreted through the kidneys. So if the kidneys are working well, that generally takes away the pain in the muscles caused by statins. And using a form of CoQ10 that's active called ubiquinol can be very helpful also. But let's get back to red yeast rice. So, according to the University of Kansas and Oregon Health and Sciences University in Portland, the ingredient in the red yeast rice that blocks the manufacture of cholesterol is called monocolin K. But there's like 9 or 10 of these constituents. So this is not totally accurate because every one of them lowers cholesterol. It's just that monocolin K is the strongest out of all of those. But there's research showing that if you use all of those together, like they would naturally be found in red yeast rice, you don't need to go to a very high dosage to get a significant reduction in bad cholesterol to LDL cholesterol. So here's Methodist DeBakey Cardiovascular Journal. I remember this doctor well. This is a very recent study out of Italy. A number of academic research institutions throughout Italy. Dr. Michael DeBakey was a huge cardiovascular doctor, a heart doctor down in Texas. Like he was at Baylor College of Medicine in Houston. He was at a bunch of different places down in Texas. But he helped develop MASH, the Mobile Army Surgical Hospital. Like there was that TV show about MASH in the Korean War. He also helped develop the VA medical system. So he's a very well-known medical doctor. He developed coronary bypass surgery. In other words, when the arteries are clogged in your heart, he developed ways to get around the clogging so you don't have a heart attack and you could go on living. He also developed the repair of aortic aneurysms. The aorta is the biggest artery in your body. It comes out of the left part of your heart that pumps oxygen-rich blood around the body. So an aneurysm is when it's kind of bubbling out, and if it gets too big, it could delaminate. In other words, there's 3 layers of tissue around each blood vessel, and they start to shift apart, and instead of blood flowing inside the artery, it's flowing through the outer parts of the artery. It's very dangerous. It's deadly. It kills many people. So he developed the repair of aortic aneurysms. He was on that. He also helped develop an artificial heart. So this is his journal. Well, actually, it's the center that he headed. It's the Methodist DeBakey Cardiovascular Journal. And they're talking about red yeast rice. And they also say red yeast rice is really only effective for cholesterol if you have sufficient monocolin K. And you should take up to 10 milligrams a day. And they said it lowers bad cholesterol. It lowers total cholesterol and the bad one, the one they call bad LDL, by up to 25% within the first 6 to 8 weeks. And they said that it also lowers apolipoprotein B. Now, let me explain what that is. Apolipoprotein B is the thing that makes bad cholesterol sticky. It's the thing inside bad cholesterol that makes it so sticky and dangerous for your heart, where it clogs the arteries, stiffens the blood vessels, thickens the blood vessel walls, and increases the risk of heart attack, stroke, kidney damage, and dementia, Alzheimer's dementia. So they said it lowers apolipoprotein B, but it also lowers matrix metalloproteinases. Now that's really important. They're inflammatory components inside the heart and inside the blood vessels that lead to thickening of the blood vessel walls. And it also lowered HSCRP, which is fantastic. HSCRP is a proxy for inflammation in your heart. It's called high sensitivity C-reactive protein. And if it's elevated, you're clogging your heart. You're going through atherogenesis, so you're blocking your arteries in your heart. But if it's very elevated, not only is it blocking the arteries in your heart from the inflammation, but it's also unstable. You have acute coronary syndrome with plaque vulnerability, which means it could chip off, it could rupture, and trigger a stroke or a heart attack. So that red yeast rice lowers the apolipoprotein B, which is the sticky part of bad cholesterol, and inflammation in certain ways. That's really important because even if you have low cholesterol, if the blood vessels inside the heart are inflamed, you're still going to clog your arteries. So you have to get rid of the inflammation as well as the cholesterol itself. Now, here's a study from a month ago. It's the journal Nutrients. It's University of Bologna. They're medical atherosclerotic research unit, so they're looking at hardening of the arteries. And they're looking at a combination of sterols and red yeast rice, which I combine frequently. In fact, I have a powder where I combine them, along with oat bran. Red yeast rice, sterols, and oat bran. Sterols work blocking the absorption of cholesterol from your food. Red yeast rice works in the liver by blocking the formation of cholesterol to a degree. And the oat bran works in your blood vessels, taking the cholesterol out of your blood vessels. It does that because it's an undigestible fiber. So the body keeps on taking cholesterol out of the system to make bile acids in an attempt to digest it, but it can't. It's undigestible. So that's how those work. They all work. See, the strategy behind that is you have 3 different natural things that lower cholesterol in 3 completely different ways. So adding them together should give a significant response, which is exactly what we see in our practice at Invite Health. So here they're looking at testing the effect of combining the sterols with red yeast rice. It's a double-blind, randomized, placebo-controlled human clinical trial of 88 people with fairly high cholesterol. So their cholesterol by the 2-month period, the bad cholesterol, the LDL, had dropped 33 points. That's 20% when they combine these 2 ingredients, compared to the placebo group. In the placebo group, the cholesterol actually increased 2.5%, the LDL bad cholesterol. So the estimated difference between combining sterols with red yeast rice versus placebo was over 39 points. That's very powerful. And that's within just 2 months, and it gets better with time. So they also saw the total cholesterol drop significantly. Apolipoprotein B dropped. Once again, that's the thing that makes your bad cholesterol sticky and dangerous. So we're seeing a lot of things improve by using red yeast rice. So here's a systematic review and meta-analysis of red yeast rice compared to simvastatin. Now that's powerful. This is the Journal of Clinical Pharmaceutics and Therapeutics. They're comparing red yeast rice to probably the second most commonly prescribed statin, called simvastatin, which is Zocor. And they're looking at 10 randomized controlled human clinical trials in people with high cholesterol. They were either given simvastatin or red yeast rice. So there's 10 different studies where people were given simvastatin, which is Zocor, or red yeast rice. They didn't see any difference. They said, overall, red yeast rice and simvastatin did not show any statistically significant difference in any of the outcomes examined. So in other words, the red yeast rice in 10 human clinical trials worked as well as a very commonly prescribed, very powerful statin that's been shown to lower the risk of developing hardening of the arteries and lowering the risk of having a heart attack and lowering your cholesterol very significantly. So here's the journal Atherosclerosis. It's researchers throughout the Netherlands, like this is the Department of Internal Medicine, Slotervaart Hospital in Amsterdam. So it's and also the Academic Medical Center in Amsterdam. And they're saying, hey, does red yeast rice work? Does it work? 20 studies. Red yeast rice lowered cholesterol, bad cholesterol, LDL, by 47 points. Okay, that's 1.02 micromoles per liter. Okay, red yeast rice lowered LDL bad cholesterol by 47 points in general, according to 20 human clinical trials. And here's exactly what they said in their report. The effect of red yeast rice on LDL bad cholesterol was not different from statin therapy. So they're saying that red yeast rice works as well as atorvastatin, simvastatin, or rosuvastatin. And they go on to say the incidence of liver and kidney injury was not different between treatment and control groups. So that's very extremely significant. Not only did red yeast rice, according to 20 human clinical trials, lower bad cholesterol by 47 points, LDL cholesterol, but it was as safe as placebo. Placebo didn't cause problems with the liver or kidneys, and neither did red yeast rice. You know, I never introduced myself. Well, I got really into this. I'm really enjoying it. My name is Jerry Hickey. I'm a nutritional pharmacist. I'm also the senior scientific officer over here at Invite Health, and we're helping a lot of people with nutrition. Let me give you a couple of email addresses in case you want to ask questions about anything we've said on any of these episodes on our podcast or on any of the radio shows. If you go to our website, invitehealth.com, not only do we have all the podcasts up there, but you could find the podcast wherever you listen to podcasts, but you also have radio programs up there. So nutrition at invitehealth.com goes to 5 of my nutritionists, nutrition at invitehealth.com. We have about 20 health professionals working here. Besides myself, we have 2 pharmacist nutritionists, about 5 naturopathic doctors, many clinical nutritionists, and a number of registered dietitians. So, you know, we really want to have people with high quality educations helping out with your nutrition. So that email, nutrition invitehealth.com. And my email is jhickey, I'm Jerry Hickey, jhickey@invitehealth.com if you want to reach me directly. So here's patients who had to stop taking statins because it was causing myalgia, muscle pain. It was causing muscle pain and muscle inflammation. It's the University of Pennsylvania School of Medicine. So this is Ivy League. And they're looking at people who couldn't take statins because of muscle pain. They gave them either red yeast rice or a milder statin called pravastatin. So these are people with previous statin intolerance. So the patients with high cholesterol and a history of not being able to tolerate statins, they had to discontinue their statins. They were randomly assigned to red yeast rice or pravastatin every day for 3 months. Now, there were some people who were so sensitive that even with pravastatin or red yeast rice, they developed myalgia. But these are like few and far between. So this is a study of people who cannot take statins because of muscle pain created by the statins. One person in the red yeast rice group and 2 people in the pravastatin group had to drop out because of muscle pain, mild muscle pain, but they didn't want to go through it, and I don't blame them. You shouldn't have it. Pravastatin lowered LDL cholesterol, the one you would call bad, by 27%. Red yeast rice was a little better. It lowered LDL cholesterol by 30%. So most of the people on the red yeast rice group and many of the people on the pravastatin group were able to stay on it even though they couldn't take statins in general, because pravastatin is much milder. It's in the American Journal of Cardiology. Now here's a study in people who already had heart attacks. I have a bunch of studies like this. Does red yeast rice make a difference? It's a study from China. It's in the Journal of Clinical Pharmacology. So they gave red yeast rice supplements to elderly Chinese people who have high blood pressure, who survived a heart attack. They already had a heart attack. They have high blood pressure, high cholesterol. It's a placebo-controlled randomized human clinical trial. It's 1,530 people aged 65 or older with heart disease, high blood pressure, and a history of heart attacks. They followed them for 4.5 years. Listen to this. This is unbelievable. Red yeast rice significantly reduced the risk of dying from heart-related events by over 29%. The risk of dying from a heart attack, sudden cardiac death, and arrhythmia like atrial fibrillation or ventricular tachycardia. Red yeast rice also decreased the risk of heart-related events such as a heart attack by over 38%. So red yeast rice was preventing a second heart attack, and red yeast rice was preventing people from dying from heart disease. It's in the Journal of Clinical Pharmacology. I would say that that's noteworthy. So here's the University of Tromsø in Norway. They're looking at 93 human clinical trials, randomized placebo-controlled human clinical trials. It's the University of Tromsø in Norway. 93 randomized human clinical trials. Can red yeast rice safely lower cholesterol? It showed in general, red yeast rice lowered bad cholesterol by 35 points on average, and triglycerides by 36 points. That's a second kind of greasy fat that clogs your arteries and leads to heart attacks and strokes. Now, not only that, but the good cholesterol, HDL, went up 13 points. That's a real winner. That's a real winner. Good cholesterol going up 13 points is, I've never seen a statin do that. I think that statin that was recently introduced from Japan, Lavalo, can raise HDL, but I've never seen it raise it 13 points. HDL works like a vacuum, sucking cholesterol out of the arteries in your heart. It's called reverse cholesterol transport. So the higher the HDL and the better it works, the more you're protected from developing heart disease or suffering with a stroke or heart attack. So not only did, according to 93 human clinical trials, did red yeast rice lower bad cholesterol by 35 points and a second greasy, sticky fat by 36 points called triglycerides. It raised a good protective HDL by 13 points. And they said, guess what? 93 human clinical trials? This stuff works as well as statin drugs. It's in the British Journal of Chinese Medicine, and they said it was very safe to use. they said that out of 93 human clinical trials, the red yeast rice was very safe to use. Now, the next study is more unusual. It's people who had a recent heart attack within the past 3 months, or people who had a heart attack after that, going back to 5 years. So the first group was people who had a recent heart attack, a week ago, a month ago, 2 months ago, or people who had a heart attack a year ago, 2 years ago, 3 years ago, 4 years ago, 5 years ago. And so there was 2,135 people who had a recent heart attack, and 2,735 people, 2,735 is a big number, of people who had a heart attack before that. And they gave them red yeast rice or placebo in addition to all the drugs they were on, whatever drugs they were on, whether it was diabetes drugs, cholesterol drugs, triglyceride lowering drugs, drugs for high blood pressure, drugs for arrhythmias, blood thinners, it didn't matter. They added red yeast rice or placebo. So we're talking almost 5,000 people. We're talking 4,900 people, just shy of that. Adding red yeast rice to their drugs lowered the risk of another heart attack by 57%, or dying because of the heart, like a heart attack or sudden cardiac death, by 49%. This is on top of the best medication. It also lowered all-cause mortality because it's anti-inflammatory by over 35%. So, I mean, that's unbelievable. Now, here's another one where they're adding red yeast rice to treatment for diabetes. These are 600 people with diabetes. They have heart disease. They have coronary heart disease, which is a major killer of people with diabetes. They clog the arteries in their heart. It gets all inflamed. A piece of it ruptures, and they have a stroke or a heart attack. So it's 591 diabetics on the best medicine for diabetes, and they were given either red yeast rice on top of their drugs or inactive placebo. And this is the double-blind randomized placebo-controlled human clinical trials. Now, they followed them for an average of 4 years. So these people are in trouble. They're not, it's almost 600 people with diabetes that also have heart disease. That's a scary situation. These people are very fragile. They're very vulnerable to a heart attack or a stroke or dementia or kidney damage. The incidence of dying from a heart-related event dropped by 44%. The total number of heart disease-related events dropped by 51%. So it prevented them from dying, but it also prevented heart attack, stroke, sudden cardiac death, heart seizures. The number of people who suffered with a non-fatal, so a survivable heart attack, dropped by 64%. The incidence of stroke dropped by 20%, and death due to all-cause mortality dropped by 44%. They also lowered the risk of needing heart bypass surgery or percutaneous coronary interventions. In other words, putting a catheter in the heart, like angioplasty. It's in the Journal of Cardiovascular Pharmacology. So there's really something to red yeast rice to crow about. And if you're on a statin, well, I don't know if you need it, but if you're on high blood pressure medication and diabetes medication, I would add some red yeast rice to that. I would add some red yeast rice. Now, I have quite a few other studies in my portfolio of red yeast rice, but, I think we've covered it pretty well. The normal dosage for red yeast rice to lower cholesterol is 1,200 milligrams twice a day with food. So there's 600 milligram capsules, so typically 2 capsules twice a day with food. I think it's even better if you add sterols to it. Sterols work differently, so they complement each other. Because when you add sterols to a statin, like a atorvastatin or simvastatin or rosuvastatin, which is Lipitor, Zocor, and Crestor, you get a lot of bang for your buck. I mean, it really helps lower cholesterol significantly better than using the drug alone, but it does it safely because you're not adding statin on top of statin. You're working in a whole different fashion. So the red yeast rice works in the liver. You create less cholesterol. The sterols work in the intestines. You absorb less cholesterol, and when you add those together, it's significant. Mm-hmm. Just one caveat. If you go on red yeast rice, add a little ubiquinol active CoQ10 to it. Even though there hasn't been any evidence that red yeast rice lowers your level of ubiquinol, we do see ubiquinol levels drop in the body with statins. So just cautionary. If you have heart disease or high cholesterol, you should be on ubiquinol anyway because it's so really good for your heart and for your energy levels. In any event, thank you so much for listening to today's episode on red yeast rice and cholesterol. You can find our podcast wherever you listen to podcasts, or just go to our homepage at invitehealth.com. Please subscribe. Please leave us a review. You can find us on Instagram, Facebook, and Twitter at Invite Health. Hope to see you next time on another episode of the Invite Health podcast, and thank you so much for listening.